Since work, which is supported by Cordaid on the National Health Insurance Scheme, is to ensure that more poor people can be able to access the services and therefore improve their health status. Since strategy is to increase what we call demand-side accountability for health by empowering poor people through the district citizen monitoring groups to put more pressure on the National Health Service and other health service providers to improve the quality of services to them. To do that effectively, we need to have good data about how the National Health Service is functioning and about the access of our constituents.
My child always falls sick. I went in for insurance because the last time I went to hospital without insurance, I paid more than 50 Ghana cedis. So since after the 50 Ghana cedis, I said to myself, why not I should just go in for the insurance once and for all.
Most of our patients, over 90% of our patients are health insurance patients. I would say over 60 to 70% of our patient loads are children who are less than 5. And generally, if you look at our statistics and the data we keep, and most of them survive because they can take treatment, and that includes blood transfusion, having oxygen, having treatment for severe malaria, top causes of childhood deaths like pneumonia and all that. All these are treated with the health insurance card without having to pay physical cash.
We work in the 50 poorer districts of Ghana. In each of those districts, we have district citizen monitoring groups.
We are now able to collect questionnaires from the field in a more fashionable manner. You can see some questionnaires here. In the past, all of this questionnaire would have to be sent down to send for us to enter. But now with the information management system, the monitoring teams just enter data from the field and send to us by email. We don't have to waste so much time to enter data again.
Come on. The
most important result we've achieved with the use of the ICT, first of all, is that it has reduced by almost 70% the time that we take to process our data and to use it to influence policy. It is important that when you're talking about influencing policy, that those for whom you want the policy to affect their lives, that they are involved, that they drive the process, that they speak for themselves. That is why the monitoring teams are so important. The monitoring teams have been trained to use ICT so they can be able to tell their story faster, better, in a timely manner.